Dr. Nitya Ramurthy, Senior Obstetrician Gynecologist, Fortis Malar Hospital, Chennai. So today's topic is about amniotic fluid, why it reduces at term. So normally we call this amniotic fluid as as you would have heard that some of your colleagues would have said that they did a C-section because the LICA was less. So today I want to tell you about that. The incidence of LICA being less at term is about 1 to 5%. Actually, the baby lies in an amniotic sac which is covered with amniotic fluid. This amniotic fluid is secreted by the amnion cells. At the 12th week, the baby secretes a small amount of urine, and the 20th week, the baby's urine forms a major contribution to the amniotic fluid. At term, other than the baby's urine, the baby's saliva and the baby's lung secretion also contributes to this LICA. So at the 12th week of pregnancy, the LICA is just about 50 ml. At the 5th month, the LICA is about 400 ml. The peak level of LICA is between 30 to 34 weeks, which is about a liter. At term, it comes down to 800 ml. So that is LICA. So what is the function of this LICA? This LICA acts as a cushion for the baby. So the baby moves freely inside this LICA, okay? And also this LICA acts as a trauma. Even if the mother trips and falls, this LICA protects the baby. Secondly, it helps in the formation of baby's muscles and bones. And when the baby swallows this LICA, it also helps in the form of its own intestinal tract and also helps in the formation of its respiratory muscles and lung. So this is the thing about LICA. Then the next thing we would like to talk about, other than this function, and also it helps to move freely inside the LICA. So now we want to find what are the reasons that this LICA drops and how do you identify. So the mother initially comes and tells you, doctor, the baby's movements are very painful, the kicks are very painful, and I find that the movements are more towards the lower abdomen. So what the doctor will do, what we would normally do is we ask him to lie down on the couch and then we'll examine the fundal height. Invariably, the fundal height is less than the period of gestation. In case she is 20 weeks pregnant, the fundal height will only be about 18 weeks. At the same time, the fetal parts are so superficial, they are very prominent. And the third thing is malpresentation. That means the baby's head is not in the lower pole, but it's in the upper pole, which is called breech presentation, or sometimes it's transverse lie, or it can be in the oblique lie. So these are things which we identify. Then how do we confirm this? So we confirm this with ultrasound. In ultrasound, they measure the pockets of LICA in 4 quadrants and artmeat. Or simpler than that is, they measure the single deep vertical pocket. If you look into your ultrasound, the fifth month ultrasound, there's an anomaly scan. In that, they will write SDP, that is single deep vertical pocket. Invariably, it will be about 5 or 6, not less than 4. Okay, but if the single deep vertical pocket is less than 2 centimeters, it's about 5, it's less than 2 centimeters, means it is oligohydramnios. That means the water levels are very less and critical. If the single deep vertical pocket is more than 8 centimeters, that means we are having excess LICA. So this is how we identify in ultrasound. Secondly, what you will notice is increased resistance flow in the uterine arteries. When the uterine artery resistance flow, then the food nutrition to the baby becomes less. When the nutrition for the baby becomes less, then the kidney will cycle less urine and so LICA becomes less. And most important thing the ultrasound we see is the baby's bladder filling and emptying. If the baby's bladder is filling and emptying, that means the baby's kidneys are functioning very well. So that's with ultrasound. Then now we come to the causes. The causes will be, let me take the baby first. Something maybe some kind of chromosomal aberration, or the baby's kidneys are not formed, like in Potter syndrome, the kidneys are not formed, some kind of malformation or some kind of obstruction to the tract, urinary tract, or sometimes it can be post-dated pregnancy, or because of poor nutrition, the LICA gets affected. When it comes to the mother in the case of anemia, or the mother has hypertension or pregnancy-induced hypertension or SLE, in all these conditions, the blood circulation for the baby is very poor. That means food going to the baby is less. So when the food supply for the baby is less, what happens? The kidneys will start cycling less urine, thereby the water levels drop. Another condition can be when she's vomiting excessively, when it causes dehydration and ketosis appears in the urine. In such case, IV fluids hydration is very, very important. So dehydration is another cause. So remember that if you are vomiting too much, you must go and see your doctor immediately and have IV fluids on. The other thing can be any kind of infection, which like torch infection, which affects the baby, and sometimes the cause may not be known. Or another thing, which is a very silent thing, is a high leak, maybe a small hole in the membrane, whereby the water must be leaking silently. The patient may not identify that; she might think that is white discharge. So these are the conditions whereby the liquor becomes less. And how do we treat it? We ask them to go and ask them complete rest, ask them to eat a well balanced diet. The diet should be very good. We ask them to use a panty liner to see whether any kind of liquor is there. In that case, what we normally do as doctor will put a speculum examination to see whether any liquor is leaking, or otherwise we have a nitrazine paper which is yellow in color. You use that nitrazine paper. If the yellow color becomes blue, that confirms that the liquor is leaking. Then the other things will be that we'll ask you to go on complete bed rest. We correct the anemia. If the hemoglobin is 8 and below, we normally give IV iron infusion. Obviously, even less than that, we give blood transfusion to improve and ask you to take iron tablets twice a day. Then her BP and her gestational hypertension or SLA, all these factors have to be stabilized. Then we ask you to have sometimes blood thinner helps. There are tablets which help to improve the blood circulation, like blood thinner or a low dose heparin injections invariably helps to improve the water level. So these are the factors, and of course sometimes amnio infusion. Amnio infusion is if we infuse either normal saline or ring lactate into the amniotic cavity to improve the liquor levels. So this is how we manage this. Then what are the complications? The complications will be cord compression. When that's because of liquor being less, cord compression affects the child's heart rate. So invariably the heartbeat becomes variable. It becomes variable during labor. In labor pain, find the heartbeat becomes variable. Or the child may develop club foot, or the child can have facial distortion. The child's lungs may not be well developed, and the other thing will be the child will become small for day. So remember that all these are very important. So to avoid these things, you must attend antenatal classes, and an ultrasound has to be done. So when we give IV infusion or a low dose heparin, every week we ask the patient to come back to do the NST and also to do the ultrasound to see whether the liquor levels are improving. If the liquor levels are improving, we can wait till term. But by near term, if the liquor is just not improving, remaining at only at 5 or 6, invariably you have to save the baby by doing a C-section. So these are the things. So in this context, I would like to tell you about an incident which I had. This patient flew down from Dubai. She was just about 28 to 30 weeks pregnant, and she was advised to undergo C-section because her liquor was just about 6, which is a very critical level. So it's when she came and approached me. Then I said, it's a dicey situation, but one thing we could do is we can admit you, give you IV fluids, we can give you low dose heparin and blood thinners to improve the water level. So and also at the same time we did everything. We did all the blood tests and we found that she was not anemic, no BP and no sugar, no SLA, all factors ruled out. I did a speculum examination to see whether there's any high leak. There was no high leak. There was no vaginal infections, there was no leukorrhea or any yeast infection. Nothing was there. So we had given her IV fluids and given her low dose heparin daily. We had given low dose heparin every day, and we were monitoring every week. Because when liquor is less, you have to monitor a patient every week to see whether the liquor levels are building up. So she progressed very well. From 30th week till 35th week, she progressed. And when beginning of the 36th week, the water bag burst. So we had no option but to do section. In my Facebook account, she would have written about her experience with me, how we saved her baby. So now you remember that your antenatal checkups are very important. Watching the baby's movements are very important. If there is any discharge in the vagina which is persistent, you should go and meet the doctor. I hope you like this topic. Till we meet again. Have a great day. Bye.